There are many advantages to early mother-infant interaction. Usually if you can initiate this interaction immediately after delivery, there are many positive benefits. And we want to go over some of those and factors related to early interaction between mother and infant right after delivery. The first thing to be noticed is whether or not the mother has been medicated during the delivery. The mother may want the medication to help reduce the pain, but it does actually play a factor, it plays a role in the interaction between mother and infant. For example, in an unmedicated mother, if the infant is immediately placed on the mother's stomach right after delivery before the cord is cut, and once again the mother's unmedicated, the infant on their own will naturally find the mother and move towards nursing. It finds the mother and it moves towards the nipple and latches on and will nurse on its own without any assistance whatsoever. However, a mother who's been medicated for whatever reason makes it more difficult for the infant then to latch on and nurse. So the first thing to be noted is whether or not the mother was medicated or unmedicated. Unmedicated makes it easier for the infant to latch on and nurse immediately, a little more difficulty if the mother's been medicated. Second, quick bonding occurs. If this is done, if the child is delivered and immediately placed on the mother's stomach before the cord is cut, there is a quick bond formed between the mother and the infant in less than 45 minutes. And this bond, in many ways, is very important for the infant's health. Now, medical reasons may intervene and make it difficult, or if not impossible, for them to be immediately united. It may be necessary for the infant to be taken away for treatment or care of some form or fashion, and this is understood. But if possible, the quick interaction between mother and infant helps form that bond, and that very close, tight bond forms in less than 45 minutes of interaction. If this bond is permitted to take place, if there isn't a medical reason preventing it or other issues intervening, if this can take place, what it tends to lead to then, advantage-wise, is better, longer, and more attached nursing. The nursing becomes more natural, it's more helpful for the child, the mother will nurse longer and will show more attachment to the child. All these are good benefits. And the outcome to the infants, of course, is positive. They statistically show to be heavier and less prone to infection if this is able to take place. So where possible, early, if not immediate interaction between mother and infant after delivery has all sorts of lasting positive benefits in terms of nursing, health of the child, attachment to the mother, and things like this. There's the realization that that's not always possible, but where possible, unmedicated, immediate interaction before cutting the cord, allowing that 45 minutes or so if possible for them to interact, begin nursing. All these have positive benefits.